Welcome to Dr. Pulp. I am here to discuss about the human anatomy, head and neck region. Introduction and osteology. Now, what is osteology? Osteo meaning bone and logy meaning study. The study of the bone, it's called osteology. Then exterior of the skull. Now we first discuss about the norma verticalis. Now you can see this is the norma verticalis view. The shape of the norma verticalis, when viewed from the above, the skull is usually oval in shape. Now you can see in the picture the skull is oval in shape. From view from the above, it is wider posteriorly than the anteriorly. Now you can see here it is wide posteriorly than the anteriorly. Now which are the bones seen in the norma verticalis? Anteriorly, anteriorly there is a frontal bone. Then posteriorly, the uppermost part of the occipital bone. Then laterally, both this side, there is a two pair of the parietal bone seen from the view above the norma verticalis. Now, which are the suture present in the norma verticalis? Coronal suture. Now, you can see here coronal suture is present between the frontal bone and the parietal bone. It is the coronal suture. Then sagittal suture placed in the medial plane between the two parietal bone. Now between the two pair of the parietal bone there is a suture that join the two parietal bone. It's called the sagittal suture. Then lambdoid suture lies posteriorly between the occipital and two parietal bone. This is the lambdoid suture. It's present between the parietal and the occipital bone. Then the metopic suture. It occasionally present in about the 3 to 8% individuals. It lies in the medial plane and separate two halves of the frontal bone. Normally it fuses at 6 years of the age. Now metopic suture is present between these in frontal bone that it fuse at the age of 6 years of the age. Some other named features. Vertex is the highest point of the sagittal suture. Now, what is sagittal suture? It is the fusion point of the two parietal bone. Vertex is present between this highest point of the vault skull. Vault of the skull is the arch roof of the skull. Then, what is bregma? Bregma is most important MCQ asked in the NEET. That what is bregma? Bregma is the meeting point between the coronal and the sagittal suture. Now it is the coronal suture and it is the sagittal suture. In between the meeting point of these two suture, it's called a bregma. In fetal skull, it is the site of the membranous gap called the anterior frontale, which close at the 18 to 24 month of the age. Then lambda. It is the meeting point between the sagittal and the lambda suture. What is the lambda? It is the meeting point of the sagittal and it is the lambda suture. It's called lambda. In the fetal skull, this is the site of the posterior frontale which close at the birth 2 to 3 months of the age. Parietal foramen. One on each side pairs the parietal bone near its upper border 2.5 to 4 centimeter in front of the lambda. The parietal foramen transmits the emissary vein from the vein of the skull to superior sagittal sinus. Abelian it is the point of the sagittal suture between the two parietal foramina. Then parietal tuber eminence. It is the area of the maximum convexity of the parietal bone. Now we can see in the picture the parietal tuber eminence. It is the highest point Maximum convexity seen in this region. This is a common site of the fracture of the skull because this is the highest point. The maximum convexity seen in that region. That's why it is the common site for fracture of the skull. Now you revise the various suture, then coronal suture, sagittal suture, lambdoid suture, metopic suture, the temporal line. Now you can see obelion, the parietal foramen. This parietal foramen present 2 to 5 to 4 centimeter above the lambdoid. This is the lambdoid. Then it present in this region, lambda. This is the lambda and parietal foramina present 2.5 to 4 centimeter above the lambda. The temporal line. This is the temporal line beginning at the zygomatic process of the frontal bone, arched backward and upward and cross the frontal bone, the coronal suture, and the parietal bone that cross the frontal bone, coronal suture, then the parietal bone. Over the parietal bone, there are two lines, superior and the inferior. Over the parietal, two line, superior and the inferior. Traced anteriorly, they fuse to form a single line. Traced posteriorly, the superior line fed out over the posterior part of the parietal bone, but inferior temporal continues downward and forward with the zygomatic arch. Now we continue with the zygomatic arch. Thank you.